Welcome to this episode of The More You Know, a series of short videos produced by the Pennsylvania Link to Aging and Disability Resources Service Area 13 partners. Service Area 13 consists of Berks, Lancaster, and Lebanon counties, and it's one of the 15 service areas across the Commonwealth that exist to provide long-term living information and resources for persons aged 60 and over, persons with a disability, veterans, family members, and caregivers. Again, welcome. My name is Margie Degler Pizarro, your host for this series. I am a geriatric and palliative care certified nurse practitioner who is a passionate advocate for abundant living and aging. The Pennsylvania Link to Aging and Disability Resources is part of a nationwide initiative developed to take a seamless approach in the way that we assist seniors and adults with disabilities who need help with activities of daily living. When you need long-term living information or assistance, call the PA Link to Aging Disability Resource Center toll-free hotline at 1-800-753-8827. The title of today's episode is Getting to Know Lebanon Family Health. The name and title of my guest is Holly Dolan, the Vice President of Community Education. And as always, the purpose of today's interview with Holly is to bring a renewed awareness about this program to you and to discuss it in detail so that service providers, as well as those persons needing these services, have a reliable, up-to-date source of information. So Holly, thank you so much for being here today. If I was to ask you to sum up in a couple of sentences how your program might help other people, what might you tell me? And share with us exactly what you do in the program as well. Thank you for being here, Holly.
Hi, Margie. Thank you so much for having me today. Just in summary, the mission of Lebanon Family Health is to provide reproductive health, nutrition services to men, women, and children in the Lebanon community, but with an emphasis on women, infants, and children. We have started out in 1973 as a Title X family planning clinic with our primary service being family planning. But over the years, we have expanded to meet the needs of the changing community, and we now offer over 14 different programs to the community. So thank you for having me today to share with what we do here at Family Health.
Thank you, Holly. And can you share a little bit about your role there?
Yeah, sure. My role is I'm the Vice President of Community Education here at Lebanon Family Health. And as the agency has grown over the years, we've added a wide variety of education programs through the Lebanon community, and I oversee those programs. To start with, we offer, since the beginning, since we opened as an agency, we've been offering parenting classes. Those have grown and evolved and changed as the needs of the community have changed through the years. In the past 4 to 5 years, we've revamped our curriculum through a partnership with Domestic Violence Intervention to be a trauma-informed curriculum for parents raising young children. The curriculum is called Be the One. It's building resilient children and families. We have 2 versions of it, one for parents of young children, which we define as birth through age 8. And then we have another version, which is for parents of teens, which we call Be the One, Building Resilient Teens and Families. And that we define as age 9 and up. And this is a trauma-informed approach to parenting to help families that have endured trauma to parent through this, whether that be a parent who's dealt with trauma or a child who's dealt with trauma, to help them parent through this. So that was one of our first our parenting programs we've been offering for many years, but it has been recently revamped in recent years to meet the changing needs of the community and the clients and participants that we've been seeing come to visit us. So that's one of our programs. We also oversee a number of other programs. We do what we call the PREP program, the Personal Responsibility and Education Program. This program is a reproductive health program where we work with teens in the community, whether it be teen groups, so we do work with small teen groups, or teens in schools. And we do a lot of work where we go into schools and run a number of different curriculums that work with teenagers about making proud and responsible choices and taking steps they need to protect themselves and others in the area of reproductive health. So that is our PrEP program. It's also a large program we run through the community. We also have and this is something that really I think talks to your link population. We have a diabetes prevention program. This is a Centers for Disease and Control curriculum that is designed to help prevent the onset of type 2 diabetes. So our mission and goal with this program is to prevent folks from getting to the point where they're going to have to start dealing with debilitative conditions related to diabetes. So it's catching it early before the disease progresses. So we look at folks that qualify for this program or folks that may have a BMI of over 25, maybe be a little bit older in the ages of in their late 50s or early 60s. May have family history of diabetes, had gestational diabetes themselves. And most of all, if their physician has said they are pre-diabetic, at risk of diabetes, or have an elevated glucose or A1C level. And so we like to partner very closely with physician offices to make sure we are capturing an audience that could benefit from this program. And through this program, we work in groups with people, but also one-on-one on helping them alter behaviors and modify behaviors and change ways of eating and activity to help them do the things they need to do to address their risk factors for acquiring type 2 diabetes. So this is a program that we do see a larger aging population in this program. So and it's a program we're hoping to really grow more and reach this audience because we do have a very big issue in the Lebanon community of high rates of diabetes. We do offer this program in English and in Spanish. And we do see through our community needs assessments that this is a needed program. So we're really trying to reach out to this audience to try to work with them to curtail type 2 diabetes.
That's excellent, Holly. In the
Yeah.
United States in general, we know that diabetes is on the rise. And so if people are listening to this and they're saying, I live in Lebanon County and I really would like to become a part of that program. My doctor did tell me I'm a pre-diabetic or I have a family history of diabetes. How would they get in touch with you? And what would it look like for them to be able to become involved in this
Mhm.
program?
Yeah, thank you for asking. Well, there's a number of ways. They could go to our website at www.lebanonfamilyhealth.org, or they could call us here at 717-273-6741 and register for the program. It is a free program. I want to mention that. I mean, this is something that a lot of people could go find and have to pay a lot of money to do. This is a free program because we do receive a grant to do this program. And we do have new classes starting in July for both English and Spanish. One is on Tuesday evenings at 5:15, and the other is on Monday nights at 5 o'clock. So we will be starting this program, and we're hoping that we can get the word out to folks to help prevent type 2 diabetes. Also, for this population that link serves, we also offer a freedom from smoking program because we also do know this is also a lot of older population that can benefit from this. And this is to help folks quit smoking. It is an 8-week program where we help folks work through identifying their triggers to smoking and understanding their addiction so that they can develop a quit plan. And because we also know only 10% of the population quits by like cold turkey, what we always refer to as cold turkey, that we really do, that to be successful in quitting, you need to be addressing the social, the psychological impacts of smoking, as well as the physical addiction as well. So we work with them to help have a quit plan of how they're going to alter and change and modify their behaviors in order to be successful in quitting smoking. So that is another education program that we do here at Lebanon Family Health.
And do I understand they're both now on site?
Oh, yeah. Thank you for asking that. Actually, with the pandemic, this has actually allowed us to explore some new modalities of reaching people through education. We do offer on site programs. We continue to do that. So now that we are making a turn around the corner with the pandemic. We still are offering, we are on-site programming, but we're also doing some online because we did find that we were able to reach some audiences online that we weren't able to reach before. So the pandemic did teach us a lesson about how we can do programming and education in some different ways to reach people where they're at.
And so when people are calling for either of these programs, they have the opportunity to either have an on-site experience or online.
Correct.
And so could you share the time frames and how it would work if they would want on-site versus online?
It would be the same sign up. We have our program planned out, and people can sign up the same way by visiting our website or calling, and then we could sign them up for either the online version or the in-person version.
Okay. And so if I understand reading the website and talking with you, people can self-refer. They don't need to be in the system per se for any of the services if they live in Lebanon County. Is that correct?
Correct. Yes, all of our programs are self-referrals, and we also, of course, work with a lot of healthcare providers and social service agencies that refer as well. So we really accept from anywhere for referral.
Okay.
And
And are there any barriers to anyone being able to sign up for these programs?
no, I think the biggest thing is just getting the word out, and also for primary care physicians to know that this is a resource out there to refer their patients, and that we're here for them, and that it's free, and to make that connection. So when primary care physicians see patients that could benefit from this program, to refer them over to us.
That's terrific because, as you shared, both diabetes and smoking are issues that are so pervasive in our community and in the United States right now. So taking a proactive approach in learning about how they affect us and what we can do is so beneficial. Can you think of maybe somebody recently, an older person that went through one of those programs and how they felt the program worked for them?
Oh yeah, that's interesting you asked that, because I can just share a story of a class I just finished teaching. And the gentleman that came to us, it was interesting how he found out, really just found out because of a flyer hanging at the bank. And so I always find that's interesting how people find us. But because we know that there is such a strong link between, um, with this age population, between smoking and diabetes. He'd come to us for a freedom from smoking class. And then while he was here, learned about, oh, we also do this pre-diabetes class. And kind of had a cross link with that as well, and was very successful in the behavior modification plans that came with the freedom from smoking class. And really the diabetes prevention program has that same behavioral change model, and will really meet his needs in being successful in that, because we do know there is a very strong link between those two issues. So that's why we're really trying to talk to our patients and clients as a whole person.
That's fantastic. And so, Holly, for someone just tuning in now who is definitely interested in the diabetes or the smoking cessation programs, either in person or online, tell us again how they would reach you and how they would sign up for one of the programs, if you would please.
Sure. For all of our education programs, you can visit our website at www.lebanonfamilyhealth.org, or you can call us at 717-273-6741. And you can sign up either online or over the phone for any of our programs.
Terrific. Holly, thank you so much for this excellent presentation and sharing the more you know by the Pennsylvania Link to Aging and Disability Resource Service Area 13 Partners Network. My name is Margie Degler Pizarro, and I thank all of you for joining us today. Be well, and remember, when you need long-term information or assistance, call the PA Link to Aging and Disability Resource Center toll-free helpline at 1-800-753-8827. And Holly, just before we go, I'm going to put a slide up so that everybody can catch that information if they didn't see it before. There we go. And Holly, thank you so much for taking time out of your busy schedule to share the information with us today.
Okay. Thank you for having me, Margie.
Okay, take care and be well.
You too.